we are introducing Dr. Gary Fisher. Dr. Fisher has worked in the treatment of addictive disorders for the past 40 plus years as a counselor, administrator, and therapist, both in private practice and in conjunction with treatment programs in Texas, Hawaii, Australia, and California. I've been to 3 of those 4 places, so that's pretty cool. His wide range of experiences includes work with adolescents, adults, dual diagnosed clients, couples, and families in culturally diverse populations. Dr. Fisher has gone through rigorous training in the use of EMDR for both addictive and trauma related issues and is certified with the EMDR International Association. As a provider of EMDR based therapy, Dr. Fisher aids his clients in learning to harness and channel their powerful creative energies in a productive and healthy manner. That is incredible. There's so much there that I'm going to have to start taking notes on being able to come back to, because there's some things that popped out to me on the second reading that I didn't catch the first. But let's get started with, if you don't mind, kind of introducing yourself as to who you are, and where you got to, how you are, where you are today and how you got there, what you're all about, essentially.
Okay. Gary Fisher. I have a doctorate in clinical psychology and a master's in social psychology from the University of Hawaii. And I've always been interested in psychology. I was always a people watcher, and friends would come and talk to me and I would give advice. And I always liked helping people as well. When 43 years ago almost, I was in nursing school to become a registered nurse.
Wow.
And my wife at the time and I were having difficulties with, alcohol and drugs and stuff. And we went from Milwaukee, Wisconsin to Beaumont, Texas to get some help. And we wound up moving to Beaumont and staying there. And then I moved to Houston, Dallas, back to Beaumont to work, and then back to Dallas to work, and then all over the place. So I went back to school. I didn't have any degrees when I was 40 years old. I went back to college to finish my bachelor's degree, went on for my master's and my doctorate after that, and worked. Prior to those degrees, I worked as a counselor and administrator in those places you mentioned, with substance abuse programs and all sorts of addictive disorders, eating disorders, gambling. Sex addicts were not quite as prominent as they are now. And it's been a great adventure. I got to work in Australia a little bit and came to Los Angeles to get my doctorate and stayed here. And here's where I am. And I have a private practice on the west side of LA, which I've been in for over 40 years now.
Wow.
So.
Yeah, thank you. And I very much relate to you. And it's funny that I have a similar story getting into psychology. And I remember sitting in the class and just looking around and just randomly asking people, what are you doing here? Like, what drew you to psychology? And the average answer was my background, just my background. I had a hardship, I had a trauma, I had whatever it was. And I really just want to help people. And, I was there